What do you know about that landscape so far? What does it look like?
Well, we're doing bone marrow aspirates, so trying to take some of those healing cells from within the bone and inject them in other areas of the body, such as the knee or the shoulder or the hip. We're using platelet-rich plasma, so that's when we draw blood from the patient, like we're checking a lab, let's say. We take that blood, spin it down in a centrifuge, and take a high concentration of the healing factors from their own blood, and then inject it into the area of pathology. So we have good evidence that it helps with mild knee arthritis, lateral epicondylitis, which is tennis elbow, and gluteus medius tendinosis. So that's just some degeneration of the tendon around the hip. And then we have other evidence that it helps for other conditions and is used for other indications. But I'd say those three, we have the best research supporting the use of it. But I'm hopeful that there will be other technology in the future.
Have you seen personally that like PRP works better than a regular like cortisone injection, or like biologics just working better than?
I have cortisone. I will still use cortisone for my injections for certain indications. Platelet-rich plasma is also used. There's some patients, they come in with this preconceived notion that cortisone is bad, and that's not all entirely true. I would say it is very useful for certain conditions. In others, platelet-rich plasma might be a better choice.
Yeah, and even in like trauma care or fracture care, regenerative medicine can be probably huge. Just instead of having this cast over your arm or over your leg for 6 weeks, you just do some injections and it will like fuse together basically.
Yeah, I would say being able to turn on and off healing in the body would be almost the holy grail in orthopedics, at least, because there's a lot of problematic orthopedic injuries or conditions in achieving healing, whether it's a tendon, cartilage injury, fracture. And we're trying to be able to stimulate healing. Some patients can't heal a fracture properly, maybe because some of their medical conditions that are contributing to that failure to heal. And if we can boost their healing with other factors, other procedures, that'll be helpful. And we have those as well. So hopefully there is ongoing research. I stay up on that, but hopefully there's more progress in the near future.
Yeah, and orthopedics, based on my knowledge, is very reliant on the body's ability to heal itself instead of going basically right into surgery. If someone has like a rotator cuff, minor rotator cuff tear, they can try and rehab it instead of going directly to the OR.
Absolutely. I think the body has an amazing ability to heal itself. As I just spoke about, there are some other factors that could be medical problems that attenuate that process, but it can heal very well. And so I would say I'm considered more of a conservative surgeon, where I always try the conservative management in the form of therapy, injections, even acupuncture, because a great number of the patients and great percentage of the patients can get better with just that. Patients don't want to have surgery if they don't have to. So most of the time, you're not burning any bridges by attempting that conservative management. And if it doesn't work and surgery is indicated, you can always do that later. I mean, that's not always the case. If you have an acute fracture, you don't want to sit on it if there's an indication for surgery. But let's say someone has a partial thickness rotator cuff tendon tear, no need to go rush to surgery. You send them to physical therapy, have them use non-steroidal anti-inflammatory medications. They can use modalities as simple as ice and possibly an injection. And a lot of those patients will get better and not need surgery.